which is the parathyroid gland. يلا please برا. As you know, the parathyroid glands are 4 glands which are located posteriorly or embedded posteriorly within the thyroid gland. So they are enclosed by the same fascia as the thyroid gland. The parathyroid glands are derived from the third and the fourth pharyngeal pouches, and they can be present in abnormal places. Mostly, the most commonly or the normal location زي ما حكينا, close to the upper and the lower poles of the thyroid posteriorly. It can be found anywhere along the descent of the pharyngeal pouches, carotid sheath, abnormally located in the carotid sheath, the pharyngeal, the thymus, and the anterior mediastinum. So sometimes they descend more than expected until they reach the thymus, which is in the behind the sternum, and the anterior mediastinum. Normally, they are located posteriorly to the thyroid, and they are embedded within the capsule of the thyroid. عشان هيك بعد شوي لما نحكي على الcauses of hypoparathyroidism, one of the causes is incidental surgical removal during thyroid surgeries. يعني لما نعمل thyroid surgery, if the surgeon is unaware, ممكن يشيل الباراثايرويدز مع الثايرويد. Two types of cells. Histology is mainly composed of 2 types of cells. The most predominant cell is the chief cells, هم cells that are responsible for production of the parathyroid hormone. And a few scattered cells in between these cells بنسميهم الأوكسيفيل cells, and the function of the اوكسيفيل cells, الأوكسيفيل cells اللي بيكونوا larger in size شايفين هون, and they have an eosinophilic cytoplasm شوي أكبر السيتوبلازم تبعهم, وفي زي eosinophilic granules زي كأنه في حبيبات on هذا الهيد. The function of the oxyphil cells is unknown. The chief cells are the predominant cells, and they are responsible for the production of the parathyroid hormone. At the same time, إيش بشوف شو هدول empty rounded spaces, شو هدول اللي بأشر عليهم. ممتاز. So within the substance of the parathyroid gland لازم يكون في fatty tissue. يعني بين الأوكسيفيلز والchief cells في fat tissue اللي هو ببين under the microscope زي هدول rounded, big rounded, زي empty spaces, زي كأنهم empty ما فيهم شيء. So the normal structure فيهم fat between the chief cells and the oxyphil cells. ليش this is important؟ لأنه بعد شوي لما نحكي على parathyroid adenoma and the parathyroid hyperplasia بيصير في growth of the chief cells mainly هم chief cells على حساب هذا adipose tissue أو fat cells. فبيروح fat cells in between. This gives an indication that the parathyroid gland under the microscope and the fat cells are not there. معناته something is happening, either hyperplasia or an adenoma. Hyperparathyroidism, it could be زي أي endocrine organ, primary or secondary. أكيد primary شو معناها؟ شو معنى primary disease of endocrine organ؟ معناته yes, the overproduction of the hormone is from the organ itself. زي مثلا هون in case of hyperparathyroidism, something happening in the parathyroid اللي هو حكينا it could be an adenoma or a hyperplasia. Most of the times, carcinoma, parathyroid carcinoma is very rare. It accounts only for 1% of the cases of hyperparathyroid. Secondary معناها from outside of the gland, يعني أي source of secretion from outside of the gland. رح نحكي عنها in a minute. The secondary, the most common cause is renal failure. الرينال failure إيش بتعمل؟ أول شيء نحكي عن parathyroid hormone. What is the normal function of the parathyroid hormone? increase the calcium level معناته the main trigger أو the main stimulant for parathyroid إيش هو؟ calcium level, hypocalcemia, excellent. لما يكون في low calcium levels in the blood, the parathyroid hormone increases عشان يزيد الكالسيوم level. وين بيشتغل الباراثايرويد هرمون؟ Mainly the main function على البون وعلى الكدني. So its main function more, the most effective function على البون. It acts on the bone. شو بتعمل؟ بتعمل resorption. شو يعني resorption؟ يعني كأنها بتفكك البون عشان تطلع الكالسيوم منه، okay? So the parathyroid hormone function is to increase the calcium level. عشان هيك the main trigger for parathyroid hormone secretion is hypocalcemia. And the main cause, the most common cause of hypocalcemia إيش هو؟ renal failure, okay? Renal failure is the most common cause of hypocalcemia. عشان هيك الناس اللي عندهم renal failure بصير في عندهم hyperparathyroid, increase in the PTH hormone. هذا ايش بسميه؟ primary ولا secondary؟ Secondary. So primary is from the gland itself. The commonest cause of asymptomatic hypercalcemia. يعني يكون عند البيشنت non-specific symptoms بس ما في over symptoms to give an indication إنه البيشنت عنده hypercalcemia. بيعمل blood test for other reasons يطلع عنده hypercalcemia asymptomatic مش عامل له symptoms. So the commonest cause of asymptomatic hypercalcemia is primary hyperparathyroid, more common in females, and the most common cause of primary hyperparathyroidism is an adenoma in 85 to 95% of the cases. رح نحكي عنهم in details. The second most common is hyperplasia, 5 to 10% of cases, and carcinoma زي ما حكينا is a very rare cause. Accounts only for about 1%. The majority of adenomas are sporadic, but it could be part of the MEN syndrome. إذا بتتذكروا حكينا عن المن ورح نحكي عنهم بآخر lecture اللي هم multiple endocrine neoplasia syndrome يكون في عندهم multiple tumors in different endocrine organs وفيها different combinations MEN 1, MEN 2A, MEN 2B. So 3 syndromes. طيب, the commonest cause of asymptomatic hypercalcemia. What's the commonest cause of symptomatic hypercalcemia? يعني الناس اللي عندهم بيكون symptoms related to hypercalcemia. إيش most common cause? The most common cause is metastasis to bone. بيكون عندهم a disease metastasizing to the bone. بيعمل bone resorption, بيعمل lysis of the bone, بيعمل hypercalcemia. So the commonest cause of asymptomatic hypercalcemia is primary hyperparathyroidism, and the commonest cause of symptomatic اللي فيها related بيكون فيها symptoms like for example back pain or symptoms related to the tumor origin is most commonly due to metastasis to the bone. A tumor metastasizing to the bone, and there are tons of tumors metastasized to the bone and cause bone resorption. كثير من tumors like breast cancer بيروح على البون. بتتذكروا follicular thyroid carcinoma حكينا كمان بتروح على البون, and a lot of these carcinomas. Genetic abnormalities in the parathyroid adenomas. PRAD1 mutation in chromosome number 11 that is involved in the cell cycle control and cyclin D1 overexpression. Cyclin D1 إيش بيعمل؟ بيزيد the proliferation of the cells, if you remember. MEN1 on chromosome number 11 as well. The cancer suppressor gene عشان هيك يصير في loss of function بالMEN1, and this leads to cell proliferation. 20 to 30% sporadic cases may show also mutation of MEN1. يعني it could be syndromatic, part of an inherited syndrome, MEN1 mutation, MEN1 gene mutation, or it could be sporadic, يعني something happening like ionizing radiation, exposure to any carcinogen, بيعمل لي MEN1 mutation, which is basically زي ما حكينا tumor suppressor gene, بيعمل loss of function. رح نحكي عنه in details منهم later on. البايوكيميكال findings بالبرايمري ايش بتوقع؟ أول شيء بالبرايمري هايبرباراثايرويدزم، الباراثايرويد هرمون ايش بيكون؟ increased، excellent، لأنه it's the primary abnormality، هو أول شيء بصير له disturbance or abnormality زي مثلا secretion بالادينوماز over secretion by an adenoma، فبيزيد. لما يزيد الباراثايرويد هرمون شو بصير بالكالسيوم؟ بيزيد. الكالسيوم والفوسفات are exchanged بالkidney to each other. So أي increase in the calcium level of calcium شو بصير بالفوسفات؟ بصير بيزيد بيقل الليفل. So هذول دائما عكس بعض الكالسيوم والفوسفات. In other causes of hypercalcemia واللي حكينا the most common is renal failure. ايش بتوقع الباراثايرويد هرمون؟ مش renal failure. Other causes of hypercalcemia other than زي metastasis مثلا. Yes, excellent. شو بتوقع بالباراثايرويد هرمون يكون؟ decreased. Excellent. ايش بدك تاخذ؟
لا دكتور، الدكتور حكيت عن other causes of hypercalcemia. لما تحكي فيتامين دي intoxication وبهجة
ممتاز. So other causes بحكي زميلكم اللي هم الفيتامين دي intoxication وايش كمان؟ والباجيتس disease. Yes, Paget's disease. بيكون بيعمل hypercalcemia. So other causes of hypercalcemia بتوقع انه يصير في عندي زي negative feedback inhibition على PTH and ATPases. Gland morphology in hyperparathyroidism. حكينا most common the cause of primary hyperparathyroidism is an adenoma. Excellent. Again, 85 to 95% of the cases, an adenoma will cause of elevation of the parathyroid hormone. So, what do we see in adenomas? Adenomas are usually single, well circumscribed and encapsulated. I will show you a picture. It is variable in weight. It could be very small, 0.5 grams up to 5 grams. يعني 5 grams معناته الparathyroid gland is very enlarged. The cells are polygonal and uniform cells. Adipose tissue, if you remember, again, is minimal in the tumor. يصيروا الcells اللي هم proliferating cells, the adenomatous cells أو chief cells, which are part of the adenoma. So they proliferate على حساب الاديبوز تيشو. عشان هيك within the lesion the adipose tissue بيكون decreased or even sometimes absent completely. Compressed surrounding parathyroid tissue in the periphery. ليش مكتوبة بالأحمر other glands are normal or atrophic؟ لأنه to differentiate بين الباراثايرويد hyperplasia and the parathyroid adenoma لازم يكون it depends on the size of the other parathyroid. يعني بالأدينوما لما يكون في tumor arising in one of the parathyroid glands. If you remember كان there are 4 parathyroid glands. واحدة فيهم صار فيها tumor adenoma. الثانية شو لازم يصير فيهم؟ atrophy. لأنه it produces a lot of parathyroid hormone. الثانيين بدهم يوقفوا البرودكشن اللي هم النورمال اللي ما فيهم tumor. The hyperplasia is something different. The hyperplasia usually affects the 4 glands. كل الجلاندز بيكونوا affected by the hyperplasia. يعني كل الجلاندز بيكونوا enlarged and all of the glands are producing parathyroid hormone. So by definition, parathyroid adenomas are almost invariably confined to a single gland. Invariably يعني زي ما بما لا يدع مجالا للشك يعني. Okay. طيب. شكل الباراثايرويد adenoma. شايفين this is the adenoma. هاي اللي عم بأشر عليها. This is the adenoma. And this is the capsule. شايفين هاي pink line. الخط اللي لونه شوي pink. This is the capsule of the adenoma. And the surrounding tissue هذا compressed tissue من الباراثايرويد itself. يعني صار في tumor بالباراثايرويد وصار يكبر بس في شوي remnants of the same parathyroid is still not part of the tumor. If you compare شايفين هون بال surrounding tissue اللي هو non-tumoral tissue بالباراثايرويد فيها adipose tissue صح؟ حكينا الاديبوز tissue ببين under the microscope على H&E stain slides يبين زي empty spaces زي هذول empty areas. within the tumor شايفين adipose tissue؟ ما في adipose tissue. So the absence of the adipose tissue and the presence of a tumor in a single gland شو بيحكي لي إنه this is an adenoma, okay? A parathyroid adenoma. والparathyroid adenoma بتعمل لي increase in the parathyroid hormone production and leads to hypercalcemia. The hyperplasia, enlargement of all four glands is usually microscopically chief cell hyperplasia or clear cells in a nodular or diffuse pattern. شكلها under the microscope ما نقدر نميزها كثير عن الادينوما. لما ناخذ parathyroid adenoma and parathyroid hyperplasia, الادينوما is زي ما حكينا confined to a single gland بس تحت الميكروسكوب الاثنين فيهم chief cell proliferation وما فيهم اتيبيا ما فيهم obvious mitosis. So تحت الميكروسكوب الhyperplasia and the adenoma appears very similar to each other. The diagnosis of adenoma versus hyperplasia زي ما حكينا depends on the size of the other glands. بالادينوما ايش بصير بالother glands؟ بصيروا atrophic مثلا. بالhyperplasia all glands are enlarged. Excellent. The parathyroid carcinoma is very rare. كيف بميزها عن الادينوما؟ Usually invasion to the surrounding structures بتكون طالعه برا parathyroid gland داخله على مثلا الثايرويد تيشو، عامله invasion على الثايرويد تيشو، فيها شوي very minimal اتيبيا او انها تعمل metastasis to other sites like the bone او the lymph nodes. So usually it's larger than adenoma, 5 to 10 grams. Hard and very adherent to surrounding tissue, عامله invasion to the surrounding tissue. فبتمسك الباrathyroid gland مع surrounding tissue. Pleomorphism and mitosis are not reliable criteria of malignancy. بكل الendocrine organs, by the way, the pleomorphism and the mitosis are not reliable. يعني بكل الأماكن فيها endocrine organ malignancy, the most important metastasis, excellent, and invasion to the surrounding tissues. فيما عدا ايش؟ الانفيجن. أي glands ممكن الادينوما تعمل invasion to the surrounding tissue. Pituitary, excellent. بالpituitary, الادينوmas, even adenomas can invade to the surrounding structures. بس بالparathyroids, if it invades to the surrounding structures and or أي واحدة فيهم metastasize, this is a malignant tumor and it's very rare زي ما حكينا, it's not common. Morphology in other organs. شو بيعمل hyperparathyroidism على organs, the different organs. احنا حكينا the main effect اللي بدها تعمل manifestations على other organs هم ايش؟ هي ايش؟ الhypercalcemia. Yes, it affects the kidney. Excellent. But the hypercalcemia leads to abnormalities in other organs. In the bone itself, or the skeletal muscle, the effect is contributory to what? The parathyroid hormone itself, لأنه the main target حكينا وين بيشتغل أصلاً parathyroid hormone. The main target for the source of calcium تبعه is bone resorption. So the effects اللي بنشوفها على البون are contributed to the production of the parathyroid hormone. In other organs هلا لما نشوف are mainly related to the hypercalcemia caused by hyperparathyroid gland وهلا رح نحكي عنهم in a minute. So in the skeletal muscle شو بيعمل؟ احنا حكينا mainly leads to bone resorption, تعمل زي destruction of the bone most of the time. And if the parathyroid hormone remains elevated for a long time رح يعمل effects على البون زي مثلا fibrosis, cyst formation, hemorrhage. بصير البون itself في manifestations أو في abnormal morphology. Ostitis fibrosa cystica من اسمها ostitis means that there is something involving the bone Osteo means bone دايما. Fibrosa لأنه حكينا there will be fibrosis if the parathyroid hormone remains elevated for a long period of time and does not respond للhypercalcemia زي مثلا in cases of adenoma. Cases of adenoma حتى لو الكالسيوم is elevated ما بيوقف the parathyroid hormone production and it continues to have its effect on the bone. Cystical لأنه بصير في زي bone cyst formation زي كأنه في فراغ بجوا البون هلا رح نشوفها. Formation of bone cysts in any side, it can involve the ribs, the skull, and the fingers. Loose fibrovascular tissue with hemosiderin. Hemosiderin is an indication of what? What should be hemosiderin? Iron من بيجي من البلاد يعني أي مكان فيه hemorrhage وبصير فيه organization of this hemorrhage بيطلع لي hemosiderin pigment اللي هي عبارة عن iron زي ما حكيتوا. Numerous osteoclasts and giant cells لأن osteoclasts are the cells responsible for bone production ولا bone resorption. Osteoclasts resorption. The osteoclasts they resorb bone. إيش اللي بيعمل البون؟ إيش اللي بيعمل deposition؟ Osteoclast. Excellent. Sometimes, if the parathyroid hormone overproduction continues on and on, ممكن يعمل لي localized من الأشياء اللي حكيناها الأوستايتس fibrosa cystica ويصير في enlargement of this area ويصير فيها fibrosis زي ما حكينا hemorrhage بيصير فيها cyst formation لحد ما تعمل شيء بيشبه التيومر زي ماس بس this is not a true tumor بسميه brown tumor. ليش brown؟ لأنه yes لأنه بيكون في hemorrhage and macrophages بتيجي بتعمل engulfment of the hemosiderin and accumulates there بصير لونه brown لأنه hemosiderin pigment إيش لونها؟ brown to yellowish. البراون tumor هلا رح أفرجيكم. Chondrocalcinosis also can happen. يصير في deposition of calcium in the cartilage and this leads to joint abnormalities and so on. And so the gout, the inflammation أو arthritis اللي هو inflammation of the joints. هذا شكل البراون تيومر أو شكل الeffect of the parathyroid hormone on the bone. شايفين هذول البلاكش areas black مش black هم multinucleated cells اللي بأشر عليهم واضحين. Okay, this is one. هذول هم الأوستيوبلاستس اللي بيعملوا bone resorption. At the same time ما عندي bone trabeculae enough. البون trabeculae اللي هذول هم البون trabeculae okay اللي هم بيكونوا أصلاً components of the bone وبينهم بيكون البون marrow. So bone trabeculae are decreased, osteoclasts are increased in number, في some degree of fibrosis. Again لما يكون هذا الappearance localized to one bone وبصير يكبر بالحجم بيكون حجمه up to centimeters بعد بسميه brown tumor. The brown tumor is a true tumor ولا false tumor? False tumor هو under يعني على imaging techniques لما بعمل مثلا X-ray or whatsoever ببين زي mass جوا البون. بس it's not a mass, it's a localized and exaggerated or increased response of the parathyroid in a localized bone. فبيبين شكله as a tumor. زي ما حكينا بيكون لونه brown because of the deposition of the hemosiderin pigment. Renal syndrome أو renal system خلصنا من skeletal system حكينا skeletal system is mainly due to the effect of the parathyroid hormone on the bone. على الكدني the main manifestations with other organs the main manifestations are related to hypercalcemia caused by hyperparathyroidism. So the renal system بيعملوا لي calcium stones وبيعملوا لي nephrocalcinosis. Nephrocalcinosis is very serious ممكن يعمل لي renal failure, acute renal failure. You see the deposition of the calcium within the nephrons, small particles of calcium within the nephrons. Metastatic calcifications in other organs like in the blood vessels, the myocardium, the stomach, and the lung. picture لما يصير في deposition of calcium in these organs أو the effect of the hypercalcemia caused by hyperparathyroidism إيش بتعمل؟ 50% of the patients are asymptomatic وحكينا it's the most common cause of asymptomatic hypercalcemia. Patients show increased calcium and increased parathyroid hormone لأنه حكينا this is related to primary hyperparathyroidism. Symptoms and signs are related to the musculoskeletal system. حكينا بيعمل لي زي cyst formation وبصيروا more prone to have fractures يعني ممكن يصير في كسور due to the effect of the parathyroid hormone, gastrointestinal tract, urinary tract, and CNS symptoms. زي ما حكينا it's the commonest cause of silent or asymptomatic hypercalcemia. In the majority حكينا هذا الشيء of symptomatic hypercalcemia, the commonest cause is widespread metastasis to the bone من any carcinoma. So this is the effects of the parathyroid hormone and hypercalcemia. البون حكيناهم in detail بيعمل ostitis fibrosa cystica, بيعمل vascular formation, بيعمل bone resorption. على الكدني if you remember حكينا بيعمل لي kidney stones, calcium stones وبيعمل لي nephrocalcinosis. شايفين كيف هون؟ حاطينها زي كأنه deposition of calcium within the nephrons. And this is very serious زي ما حكينا ممكن يعمل لي acute renal failure. على CNS بيعمل depression and seizures في hypercalcemia. وعلى GI tract it affects أول شيء ممكن تعمل لي gallstones، ممكن تعمل peptic ulcer disease، ممكن تعمل acute pancreatitis. ليش بتصير peptic ulcer disease؟ لأنه hypercalcemia stimulates the production of the trypsin and it increases the acidity of the stomach. بيعمل duodenal ulcer. بالبنكرياس ليش بصير في acute pancreatitis بالhypercalcemia؟ ممكن الgallstones might contribute. The other thing إنه بصير في premature activation of the enzymes تعمل autodigestion of the pancreas. يعني يصير في premature activation of the pancreatic enzymes جوا البنكرياس itself فبيعمل لي autodigestion of the pancreas itself اللي هي الميكانيزم of acute pancreatitis اللي مكتوب بالGI. Nephrocalcinosis of calcium crystal accumulation within the nephron وبيعمل لي necrosis of these nephrons ولما يكون في necrosis of the nephrons this leads to acute renal failure. In secondary hyperparathyroidism, حكينا the most common cause is chronic hypocalcemia due to chronic renal failure. Glands are hyperplastic. They start to compensate for this hypocalcemia caused by kidney disease. Kidney disease بيعمل hypocalcemia. They try to respond to this by hyperplasia. كل glands, the four glands are hyperplastic. ليش بيصير في hypocalcemia بالrenal failure؟ زي ما حكينا there will be decrease in phosphate excretion, elevation in serum phosphate زي ما حكينا هدول الاثنين they will exchange to each other. بيزيد calcium excretion within the kidney and this leads to hypocalcemia. When calcemia stimulates the parathyroid hormone or the parathyroid glands to produce more and more parathyroid hormone. آخر شيء رح نحكي على hypoparathyroidism. Hypoparathyroidism is very serious كمان. It is much less commoner than hyperparathyroid, but it's very serious. ليش it's very serious? As you can see, it can cause symptoms related to the neuromuscular structures, تعمل convulsions, تعمل tetany, and it might lead to cardiac arrhythmias. وحكينا secondary hypoparathyroidism is damage to the glands or its vessel during thyroid surgery. Sometimes لما بعمل thyroidectomy حكينا لأنهم they are enclosed within the capsule, the same capsule with the thyroid gland. If the surgeon is unaware ممكن يعمل damage of the vascularity فبصير فيهم necrosis and death أو يصير فيهم removal with the thyroid gland. Idiopathic and autoimmune diseases, pseudo-hypoparathyroidism when the tissues are resistant to the PTH effect, and sometimes congenital absence in newborns with congenital abnormalities. زي ما حكينا it's very serious. Usually بيجوا بتيتاني شو يعني بصير؟ بصير عندهم تشنجات بالايدين بالجسم كله. Convulsions and neuromuscular abnormalities. Later on if left untreated ممكن تعمل death due to cardiac arrhythmias. شو يعني arrhythmia؟
تم انتظام ضغط القلب.
يعني loss of the normal rhythm of the heart. يصير في different types of arrhythmias. Atrial arrhythmias or ventricular arrhythmias. يصير the heart is not contracting normally. كل rhythm of the heart is abnormal فممكن يصير في death of the patient due to arrhythmias.
دكتورة بس ممكن سؤال؟ مش المفروض يقل تركيز الكالسيوم بالجسم؟
يقل تركيز الكالسيوم بالهايبوكالسيميا. Yes, the main manifestations are due to hypocalcemia. Yes.
طب مش الكالسيوم هو اصلا يعني للمسل كونتراكشن بيفيد المسل كونتراكشن؟
Yes.
فالمفروض لما يقل يعني تقل المسل كونتراكشن يعني تقل الكونفولجنز يعني.
Yes, the convulsions or epiphany are due to the effect on the brain مش للperipheral muscles. The brain itself abnormal and it gives abnormal signals to the peripheral muscles so بيعمل tetany, okay? مش من المسل itself. Yeah. Yes. Yes, the whole things will be abnormal, the full cells in the body. And as you know, the calcium is very important for the normal functions of the cells. All the cells will be affected. But we mentioned the most serious things, the life-threatening things that are related to hypocalcemia and because of the hypoparathyroidism.